On the next slide, we turn to the third part, I guess you could say, of looking at cancer. We looked at deaths, we looked at incidence now, and now we look at screening. Okay, and looking at screening, the target, what we want here is the percent who have had screening according to the guidelines. We want that to increase. And if we look at the figures from 2008 to 2010, in fact, screening meeting the guidelines for colorectal cancer went up 14%. I think that's actually a very impressive rise over a short period of time. Call your attention to the race and ethnicity side and the income side, okay, to see the disparities. I think it's fairly stark, these disparities. But if you keep that in mind, though, when we go to the next slide and we look at screening for breast cancer, it's interesting here that the disparity in income basically persists, except for the very lowest income figure, which is higher than one would expect based on the colorectal figure. But interestingly enough, we don't see the same distribution of disparities by race. And in fact, the black, the white, and the Hispanic rates are all very, very similar. Turning next to, on the next slide, to the genetics, the objective here has to do with women who have a family history of breast and ovarian cancer. That's, and this diagram, the pie chart shows it, that this is about 5% of women, okay? And how are we doing? Well, on the next slide, we can see that in terms of point estimates, we've gone from about 33 or 34% who discussed genetic testing of women with a family history who discussed genetic testing up to something over 50%. Well, this is very positive, but, and there's a significant but here. The but is that the numbers here give rise to some very large confidence intervals. And while you'll see in our charts, it says that we have met the target, I would not put that in the bank and take it home. We need to see what happens with this over time. I think the point estimates are always encouraging, but sometimes I think we get too much encouragement just from the point estimates, because as some wise statistician once said, 2 points don't make a trend. Okay? All right. You can quote me on that one. I'm not the wise one, though. On the next slide, there's a summary of the cancer objectives. I want to call your attention here to the fact that we've dealt with 6 of them here, but there's a total of 27 cancer objectives. And as you'll see in the slide I'll go to in just a second, we seem over this very short period of time to evaluate, we're doing well, okay? But it's important to point out, for example, that melanoma deaths has a red dot on it. Okay? It's not going in the right direction, although it's moved very, very, very small amount. Okay? So in order to discuss that, we need to know something about screening and other interventions. Okay, so to go to the next slide, this summarizes the 27 cancer objectives. The greens are all movement either target met or movement in the right direction. The yellow is no change, and then there were 4 objectives that moved in the wrong direction, albeit maybe a very small amount of movement, given that we're only evaluating the difference between around 2009 or maybe a little bit earlier than that and the current time. And there are 8 objectives for which we either have only baseline data or developmental data. The next slide turns to genomics, and we have 2 objectives here, and I think I've already discussed that chart with the 2 bars. And while it's green on here, as I said, I'm not sure that I would say we have won we have won that objective at this early point that it's met the target. I think we need to see more. And the next one, in terms of a measure or data to help us detect or evaluate the percentage of people being tested for colorectal cancer with the Lynch syndrome, we need data for that. So to summarize, which I can do very briefly, we clearly, over the past decade, there's without a doubt been progress in reducing death and incidence rates for the major cancers. And the cancers we're focused on here, colorectal cancer and breast cancer. The disparities, though, I think are stark and persistent. There's particularly the disparity between whites and between the white rates and the black rates. We continue to have, even with, as of late, even larger surveys, we have a challenge in collecting data from the smaller populations. We also have something that we haven't had before in the third bullet, which is that screening guidelines are changing more rapidly than they did in the past, which poses a challenge in just tracking how well we're doing. It's entirely feasible, but it is a bit of a challenge. And again, in the genomic objectives, particularly the one that we're looking at, we're challenged here by the relatively small target population and the fact that we'd love to see a much larger survey that could give us more figures on it.